Two Parkinson parents asked the question. Both my parents suffer from Parkinson's disease. My mother, currently 85, has been struggling with Parkinson for at least 10 years. In 2006, she had a DBS implant, which successfully treated her left side. The disease, however, has progressed to her right side, and after much thought, we have decided the risk of a second DBS operation is too great. Her most difficult issue is severe stomach pain, the onset occurring about 90 minutes after her noon meal. And now, within the last month, she is also experiencing abdominal pain regularly each evening following supper. Motilium has not been effective in alleviating her debilitating symptoms. Sometimes it offers minimal relief. She has seen multiple specialists, but no one seems to be able to find a successful treatment. Could you please make some suggestions? Well, to Parkinson parents, the issue of abdominal pain is not uncommonly encountered by a Parkinson disease patient. Of course, you've done the right thing. The first thing to think about is medical issues, and so you want to see a gastroenterologist and make sure a few things are done. So they can do some scopes to make sure there's nothing going on within the upper GI tract and the lower GI tract, but there's also something called a gastric emptying study. And with a gastric emptying study, they give you some dye and they look to see how long it takes that dye to empty out of the stomach. If there is a delay in gastric emptying, that can explain some of the symptoms that you might be seeing. The problem is that some of the best agents to treat gastric emptying or gastroparesis emptying problems, those agents have been taken off the market, and so people have been using things like erythromycin-derived antibiotics to try to speed motility. Now, be very careful with drugs such as metoclopramide. Metoclopramide or Reglan can actually make your Parkinson disease symptoms worse. Now, when we see patients who have abdominal pain and Parkinson disease, we pay attention to a couple of simple rules. First of all, wearing off of your Parkinson disease medications can actually result in these symptoms. So it can be a wearing off phenomenon. So the first thing we like to do is we like to try to move the medication intervals to 2 hours. So you take meds every 2 hours and make sure you're taking a good enough dose of Sinemet every 2 hours to make sure you're not wearing off. Sometimes we'll see the abdominal pain, which is often dystonia or the muscles contracting against each other, resolve just by moving medication dosages closer. The second thing that we do is we try to move meals to be after you take medications. And so the cardinal rule is give your meds 1 hour head start before you eat. And that way you won't have any sort of interaction. The other issue is protein. High protein tends to tie up the Parkinson disease medications, so sometimes reducing the amount of protein in your diet is helpful. All of these things, I think, may have the potential to help you and to help your parents, and so we wish you luck. Please feel free to ask us questions on the National Parkinson Disease free website, www.parkinson.org, and we also have a free 1-800 number to try to help patients.